It's a call for help that has finally been answered. The state legislature giving an additional $12.9 million in funding to emergency medical services under the new budget passed earlier this week.
The paramedic and EMT shortage in Michigan has gone from bad to worse during the pandemic, but leaders in the ambulance industry say this boost in funding could be just what they need to attract more people back into the field. News 8's Jacqueline Francis explains.
Across the state, there are about 1,000 openings for full-time paramedics and EMTs. In Muskegon County, their ambulance provider, ProMed, with Mercy Health, has 6 openings alone. The director telling us that means less ambulances on the road. While they typically would have 10 out during the day and 5 at night, with staffing shortages, that's not always the case.
We've had a number of days where we're below that number. Not uncommon to be running 75% of where we'd like to be on ambulances.
He says patients are still getting an ambulance as the system is designed to prioritize calls by level of emergency, but it's other, less urgent calls that can fall by the wayside.
A lot of patients move from hospital to hospital. Those may have to wait if they're not, again, if it's not a life-threatening need to move them, they may sit for hours waiting for an ambulance transfer. And that's just what we have to do right now to make sure that the critical patients are taken care of.
One Muskegon family is voicing concerns of their own. Toby Gabriel and his mom called for an ambulance earlier this week after he injured himself while having a violent seizure. The family asked to be taken to a Spectrum hospital either in Grand Rapids or Grand Haven, saying that's where their preferred care is for his epilepsy. But ProMed couldn't oblige, telling them
there's only 3 paramedics here in Muskegon. And due to that fact and the COVID, they said that they wasn't able to.
The director of ProMed says it's not typically their policy to take patients outside the community unless there's a verified medical reason to do so. But Gabriel says they've done it several times for him in the past. For him, no longer being able to rely on that service or just hearing about the EMS shortage in general has him concerned about the future.
I really don't know when my seizures come on. It's just within like a snap of a finger and I'm into one. To not have that transportation like I used to, it makes me feel like Muskegon's going down a little bit.
That was Jacqueline Francis reporting. ProMed in Muskegon and the Statewide Ambulance Association says this additional funding will give them the ability to train and attract more people to the industry, seeing that as a possible solution to the ongoing staffing shortage.